Look at this generated video showing a viscous liquid hitting a thick, impermeable barrier. This illustrates the physical limits of absorption for topical treatments. If you are dealing with a drooping lower face or sagging jowls, expensive serums and creams consistently fail to reverse the decline because they are physically incapable of penetrating deep enough to reach the problem. Facial stability relies on a multi-layered structural system of connective tissue and bone that exists independently of the surface skin. This animated diagram strips away the epidermis and dermis to reveal the superficial musculo-aponeurotic system, or SMAS. This is a complex netting of fascia and connective tissue. When this deep fascial layer loosens, it triggers a chain reaction of architectural collapse across the entire lower face. The degradation goes even deeper into the skeletal foundation. Through a process called osseous resorption, the underlying bone structure literally dissolves, loses density, and reshapes as we age. Attempting to treat this deep structural failure by simply applying surface-level hydration completely misses the actual biomechanical root cause. Reversing facial aging requires abandoning the focus on superficial dermatology. To rebuild the face, you have to target the underlying biomechanical and endocrinological systems. Before looking at physical anatomy, we have to look at a systemic saboteur. The human face is a highly concentrated sensory and hormonal organ. Out of your entire body, the face possesses the highest density of hormone receptors, specifically wired to your emotional states. When you experience chronic, unresolved mental stress, your body enters a state of sustained hypercortisolemia, a constant elevated presence of the stress hormone cortisol. Elevated cortisol acts catabolically at the molecular level. These cortisol structures actively dismantle the cross-links within your dense collagen lattice. As the collagen breaks down, expanding lipid deposits settle into the compromised structural gaps. Clinically, this is localized fat accumulation, referred to as cortisol face. Physical stress burns itself off through exertion, but pure psychological burden does not. The body lacks a natural metabolic off-ramp for mental stress while sitting still. To clear these accumulated stress hormones, you have to introduce physical movement. Walking provides the necessary physiological mechanism to metabolize the excess cortisol generated by a stressful day. Since cortisol actively degrades the collagen lattice, physical activity provides a direct pathway to metabolize those hormones before they can further weaken the facial structure. We can now pivot from endocrinology to biomechanics, specifically looking at the lower mandible and the masseter muscle complex. In the ancestral human environment, survival required consuming tough, unprocessed meats. Processing that diet demanded massive mechanical chewing force on a daily basis. Biomechanical force factors on an ancestral jawbone illustrate osteogenesis. Extreme mechanical load physically stimulates bone growth and dense musculature. Contrast this with our modern hyper-processed soft foods. They require almost no mechanical resistance, causing those force vectors to shrink to near zero. Without this daily mechanical load, the muscles and bones of the lower face can experience functional atrophy, leading to a loss of structural definition. The modern jawline lacks structural definition because it has been entirely deprived of its evolutionary mechanical resistance requirements. That lack of tension brings us to the primary anatomical culprit responsible for extreme lower facial ptosis, commonly known as the turkey neck. This animated diagram isolates the platysma muscle. Notice its specific anchor points, spanning from the clavicle directly up to the mandible. When this muscle becomes loose, the entire submental area hangs. A critical professional misconception is that you can tighten this area with static, sustained neck stretches. Applying slow, passive tension to the platysma actually worsens the drooping. Zooming into the myofibril structure explains why. The platysma is predominantly composed of type 2 fast-twitch muscle fibers, which are designed for rapid firing during actions like smiling or gasping. Type 2 fibers require high-velocity, explosive impulses for a hypertrophic response. Passive elongation does not stimulate them. Treating the platysma like a postural muscle accelerates its structural failure. To rebuild it, it must be trained like a highly explosive sprint muscle. To reverse facial ptosis, you must intentionally simulate the missing ancestral mechanical loads and properly target those type 2 fibers. The first clinical intervention is designed specifically to activate the platysma. It relies on rapid impulses. This 3D wireframe illustrates the correct execution. You fire rapid, explosive microcontractions in the submental area underneath the chin, completely avoiding any sustained holding or stretching. The precise protocol is 10 to 15 rapid impulses per set, with a brief rest. You will feel acute localized soreness quickly. That fatigue is the correct, necessary indicator that you have successfully activated the type 2 fibers. The second intervention combats masseter atrophy. This technique relies on mandibular resistance. This diagram displays opposing force vectors to show the mechanics. You place an upward physical barrier, like your fist, under your chin, while actively forcing your jaw downward against that resistance. The prescription for this resistance technique is 3 sets of 10 repetitions, spaced by 30-second rests. The final structural corrective targets a different functional movement: mandibular protraction. This lateral view of the skull shows the isolation technique. By forcefully jutting the lower jaw forward, you engage a completely separate anterior muscular chain to pull the mandible into horizontal protraction. Applying this specific horizontal load reinforces the distinct structural boundary and definition of the lower face. The protocol for protraction matches the resistance work: 3 sets of 10 repetitions with 30-second rests. Facial architecture is not locked into a permanent state of decline. It is a highly plastic system that responds to specific inputs. By applying targeted biomechanical force to the jaw and diligently metabolizing systemic cortisol through movement, you can structurally rebuild the face from the inside out.